update for Sunday. I can advise that there are currently 32 active cases in Victoria. There are 3 new cases. These 3 new locally acquired cases are all linked to the Black Rock Cafe cluster. That is a known cluster to our public health team, and there are no new cases associated with the hotel quarantine program. A total of 3,929,815 test results have been received. That's an increase of 22,477 since yesterday, and really want to thank Victorians for their great response yesterday. Saturday was a very, very busy testing day across our testing centres across the state, and I want to acknowledge up front that people did have some long waits for their tests, and we want to thank people for their patience. It does show that Victorians are understanding the real importance of going and getting tested, whether they're return travellers, whether they've got any symptoms. It's a really great response from the Victorian community. Today we've got over 190 testing sites operational throughout Victoria, so there are more opportunities today for Victorians to get tested. And as part of that, I do want to acknowledge the hard-working healthcare staff over the course of 2020. As we've seen, our hard-working healthcare staff worked so hard protecting and supporting the Victorian community at our staffing testing sites day in, day out. And over this holiday period, we've seen a number of them take some well-earned time off. And I really want to thank those staff who have returned early from their break, from their holiday period, to provide extra assistance with the testing sites across the state. All DHHS run drive-through sites, that's 13 in total, will operate today from 8 a.m. to 8 p.m. until further notice. The Melbourne Showground site will open extended hours, 9:30 a.m. to 7 p.m. tonight, and that will be the system going forward. They will have all 4 lanes open at the showgrounds. Yesterday, Saturday, they were able to do 1,027 tests at the Melbourne Showground site alone, and that was an increase of 25% on the day before. Testing turnaround times continues to be very, very strong. 88% of people receive their test results within 24 hours, and 99.9% of people get their test results within a 48-hour period. We also want to encourage Victorians to go and check out the coronavirus website before they do head out to a testing site to find obviously the closest, the most convenient testing site that's available to them that is in their local neighbourhood. In regards to Victorian travellers returning from New South Wales, all Victorians who have returned recently from New South Wales to Victoria have now received a text message alert. This alert contains information about what they're required to do on their return to Victoria. Now, it's important to note that the health advice that's contained in this text message is tailored to the circumstances of each individual or family that's returned from New South Wales, and that information is based on the data that was contained in their permit application as they returned to Victoria. And if, for example, if people have applied for multiple permits, that advice may differ depending on the permit that has been used to enter into Victoria. Now finally, before I throw to Alan to give the public health advice, and then Jerome to talk a bit more of an update about the testing capacity and the border entry exemption process, I do want to indicate again, thank Victorians for coming out and getting tested yesterday in strong numbers, and again today. I think Victorians can take great comfort from today's numbers. 3 cases, all linked to the existing known cluster, and the public health advice is that Victorians should take great comfort from the fact that these are linked cases. They're known to us. There's been strong work by our tracing team, talking to and interviewing the primary and secondary contacts of our known cases. We have the testing regime that's out in force yesterday and today, and again, Victorians are doing a great job following the rules, wearing masks, practicing COVID safe behaviour. This is all contributing to the low number of cases. 3 new cases, all linked, is a strong and positive sign about where Victoria is today in terms of managing and responding to the COVID-19 pandemic. And finish by thanking again Victorians for their tremendous effort, whether it's in getting tested, doing the right thing and isolating depending on their local circumstances, and following the rules and wearing masks. It's making a big difference. We'll need to continue continue to do this for a little while yet, and knowing that it's all contributing to making our community a COVID-safe community. I'll now ask Alan to add to my comments.
Thanks, Acting Premier. So we now have 21 cases in this cluster, of which 13 had attended the Thai Cafe on the 21st of December. This includes the original case from Mentone, a couple who are linked to the first case in Mitcham, a couple who were diagnosed in New South Wales, and a number of others, including the 3 new cases from yesterday. So the 3 new cases from yesterday were all present at the cafe on the 21st of December. The other 8 cases are all linked, either directly or indirectly, basically through family gatherings over Christmas. As yet, we haven't found the source, but we're looking at several lines of investigation, including one person that had been in Sydney, but outside the Northern Beaches area. We've had more genomic results back, and now a total of 10 isolates, and they are all consistent with transmissions between each other, and also a link to the New South Wales cluster. I want to emphasise that everyone has been very cooperative, including the cafe, who kept quite good records, and that just reinforces the importance of keeping good records. I'd like to take this opportunity to thank everyone for their cooperation, and I'm sure it's not what everyone expected to be doing over New Year's, and we're doing our best to support everyone during this difficult time. Obviously, everyone has been quite active over the Christmas period, and just to give you an idea of how meticulous the interviews are, I'm told that one interview took 5 hours to complete. With more than, I think, about 220 close contacts that are in quarantine at the moment, and about 359 secondary close contacts, but noting that that number will change very quickly as they are cleared when their primary close contact tests negative. With this number of close contacts, we're expecting at least some of them may become cases over the next week or so. But what is important is that they're in quarantine when they're diagnosed, so that the risk of onward transmission is reduced. At the moment, all the transmissions, again, are at the Thai Cafe or in family gatherings outside, but we do have a long list of potential public exposure sites. These are cases that have been moving about in the community. At this stage, we don't have any transmissions at those sites, but that does reinforce just the importance of masks and the limits on private household gatherings at this stage. But it is certainly looking encouraging at this stage. But we still have a little way to run. Just going to hand over to Jerome to talk about testing.
Thank you, Alan. Good morning. So just to reiterate some of the testing numbers, so 22,487 tests completed yesterday. And again, my deep thanks to everybody who came out and got tested yesterday. I know it was a very long and busy day and some long wait times at many of our testing centres across the state. I still got thousands of results being processed in the lab from late yesterday afternoon, early yesterday evening. They'll be coming through today, but I'm expecting at least another 8,000 or 9,000 results on top of those 22,000 from activity that was undertaken yesterday. They will be, of course, in tomorrow's numbers. As the Acting Premier said, we have 190 testing sites open across the state today. The 13 drive-throughs will be open the largest drive-throughs will be open for a full 12-hour period. We've also had a number of testing sites open at 7 o'clock this morning, and I know that some of the early opening sites, particularly the ones I've driven past on the way here, some of them already got significant queues waiting at them, so please check before you depart onto your most convenient testing station. We have additional sites that have opened up yesterday, today, and will continue to be open over the coming days at Wantirna. The Acting Premier has mentioned the showground, the major testing site of Showground Extension. We have an additional drive-through at Werribee, an additional drive-through at Hallam Secondary College. We also have the facility at the State Basketball Centre and at Wells Road in Beaumaris, amongst others. So again, our website has full details of all the sites open. Also, my thanks to the Primary Health Networks, the GP respiratory clinics, and many other testing facilities, including our colleagues in private pathology, who have all gone the extra mile over the last few days to get their centres open. Every test is important in this environment, and I thank everybody who's making such a heroic effort to ensure we provide support to the Victorians coming out over the last few days and over today and over the days ahead. It will, of course, be quite wet out in many parts of the state today. We've got gumboots on order already in some of our eastern testing centres. So I would again please encourage people, do prepare for a significant wait, particularly at the busier centres, and make sure you've got things to do while you're waiting in those lines. We've seen some very positive numbers, nevertheless, as a result. There's we've done a 35% uplift in the total number of tests delivered just in the south and southeast suburbs yesterday compared to the day before, so we are getting the numbers through. So if you are waiting, please bear with us. Bear with the system. It is important that we get these tests done so we can continue the encouraging trajectory we are on with this BlackRock cluster. Alan's already gone through the details of the BlackRock cluster, so I won't repeat his comments, except to say we do have 51 exposure sites listed on our website. That is a significant number of exposure sites, and of course it highlights that with the 21 cases in this cluster at the moment, that people do rightly travel around quite extensively at this time of year. Please take note that on our website there are different directions depending on the extent of exposure at each site. So there are some exposure sites such as the Doveton Church, particularly the Spanish speaking service, and of course the BlackRock Cafe itself, where we are asking people to quarantine for a full 14 days if they've been there in those time windows. There are any other exposure sites where we're asking people to just test and isolate until they get their result. Our public health advice is proportionate, and our public health advice, both for people going to these exposure sites as well as people crossing the borders, is targeted to the individual circumstances. I appreciate that can lead to confusion as people make multiple trips to different places, but please do follow that advice very carefully to make sure it's relevant to your particular circumstances. In terms of the New South Wales border closure, and again I'll repeat our comments from yesterday, my thanks to the 60,000 people that came home from New South Wales over New Year's Eve and New Year's Day. We saw huge numbers of people follow the advice. As we've trailed before, it was extremely important to get people back to Victoria to address the growing risk of exposure in New South Wales. All 60,000 permit holders who returned will have received bespoke direct messages relating to their situation. We've got people coming back from the Blue Mountains and Wollongong. We've got people coming back from other parts of rural New South Wales on different days. Depending on when you return, depending on where you went, that is what the public health advice to you is geared around. So please go back to the permits and the information in the permit that you have, and go back to the advice you're getting from us in the DHSS in terms of our text messages and phone calls to you. That is the advice for your situation. Any concerns, please contact our call centre. I'm also pleased to confirm that we're seeing some really good testing response from people both coming back from New South Wales and in particular people in the BlackRock cluster. Over half of the people who are regarded as close contacts have now been tested and have had their results through already. They of course continue to isolate, and we are also seeing some encouraging results with tests coming through for people who have been across the New South Wales border. We are continuing to follow up with people who have crossed over from New South Wales in the last couple of weeks, and particularly those who may not have yet recorded a test result. There is a very small number, but we are following them through individually, and they can expect a knock on the door. So my advice to everybody who has crossed over from New South Wales in the last couple of weeks, please follow the advice you were given in your permit. Please follow the advice we're giving you in our text messages and phone calls, or we will be forced to send people around to knock on your door. Frankly, that's not a good use of your time, and it's not a very good use of our time either. Finally, a word around people who still find themselves in New South Wales and who still have an urgent need to come back to Victoria. We currently have 1,500 people who have applied for an exemption to return to Victoria after we closed the border on midnight on the 1st of January. Those exemptions are being triaged and we're working through those in priority order. It will take us at least 48 hours to process those exemptions, and we will deal them in priority order. So people will have to be patient. I stress again, there is an exemptions process. It is being reviewed by the Chief Health Officer and by his delegates, and we will get to them as quickly and as safely as we possibly can, recognising of course that we've been providing advice for a while now around the risk of travelling into New South Wales, and of course 60,000 people did manage to get themselves back over the border in time, and I thank them for the extra efforts that they went to do so. Finally, before we take any questions, again, I'd like to thank all Victorians, whether you're working within the public health system, the people who've come out and come back from their holidays to work on the testing sites, to work in the pathology labs, to work on the contact tracing effort as we run this outbreak to ground. And as Alan has said, it is pleasing to see that the cases today are still part of that primary close contact cluster. We have a very clear set of indications now around the directions of this cluster. But of course, we must be vigilant to make sure that we identify any other possible change of transmission that may be out there. With this number of people coming back from New South Wales, with the established link genomically between our cluster here and the wider New South Wales cluster, it is important that we now do everything we can to identify any possible sources of transmission elsewhere in the state, and therefore the testing effort that everybody's putting in, the efforts of thousands of people coming forward to get tested every single day, is incredibly important so that we can make sure we flush this out once and for all. Now that we have our borders closed, once we get these outbreaks back to zero, we'll be in a far better place.
Gerard, you're talking a lot about people having long delays at testing sites, and that you said this yesterday and the day before, they should just suck it up and wait in line, and that's the appropriate thing to do. But the reality is many people are being turned away from sites entirely, and then turned away from a second or third site. We're getting hundreds of people emailing in every day. How many people are missing out on tests? Could that compromise the testing effort? And how is it acceptable that days on from the beginning of this outbreak, we're still getting hundreds of people turned away every day?
Well, I think, look, if you look at, we have tested over 70,000 people over the last few days in association with this outbreak. So people are getting through and people are getting tested. And we have capacity at our testing centres. Not every single testing centre has capacity, and again, some of the ones I've driven past this morning will introduce periodically temporary closures to allow the backlog to come through, and then they will open up again. So I am going to ask people to continue to persevere with us. That's why we've got probably an extra 30% capacity in today compared to yesterday at our biggest centres, not every single centre. That's why we'll have more capacity on again tomorrow as more of our staff come back from their holidays. So we are continuing to add every single day the additional capacity we possibly can. We are asking people to get patient. People are getting through the system. It is just taking longer.
Is there a plan to update the DHH website with how long these wait times are? Often the information is very much out of date. The MSAC one this morning closed after 20 minutes after it had been opened. Is there a way that we can tell people? Is there plans for that in place?
Look, we're putting as much information on our website as we possibly can. And I think everyone will appreciate these are rapidly moving developments. We've got a large testing network across the state, 190 test centres. Our focus is about making sure we get as much capacity on the ground to get people tested. We will put whatever updates we possibly can in real time. But we are, unfortunately, going to have to ask people to be patient and to work with us on this one. As I say, we are working on the ground as rapid as we can. We've saw 26,000 people at least come through our testing centres yesterday. We'll continue to work on that basis.
We did 18,000 tests in the 24 hours to yesterday. We did 22,000 in the 24 hours to today. New South Wales managed more than 30,000 yesterday. We've managed more than 40,000 on other occasions. They've managed more than 60,000 on other occasions. What's causing the hold up, and why haven't we got the resources in, and why hadn't we planned for this possibility, given the importance of getting on top of this?
Look, it's absolutely critical that we get on top of this, and we have a testing system that's geared up to coping with 30,000 tests a day.
Why didn't we do 25,000 in either yesterday or the day before then?
No, but I think if you look at the numbers we've got coming through, as I've got at least 8,000 tests sitting on the labs at the moment that were delivered yesterday and that are coming through, so the test results are coming through. If you look at our pathology performance, with 88% of those test results coming back out within 24 hours, we have a very effective back-end system that continues to perform very well. I absolutely appreciate and understand everybody's frustrations. I think also we recognise, we started this outbreak in the middle of the period, but after Christmas, before the new year. We have been working here in Victoria exceptionally hard for 9 months. Our frontline clinical staff and all the people who work in our testing system have been working phenomenally hard for that entire period. And we've seen a significant number of people rightly take some well-deserved leave, as we see across the wider sector. So we've had to gear up and mobilise. We've added around 40% more capacity on Friday compared to what we had planned to do in response to the outbreak that we were starting to see. We've stepped it up again yesterday. We'll step it up again today. But this is not something we can turn on at the flick of a switch, and it's something that we continue to work on. So we're confident that we can continue to support the numbers we're seeing at the moment. We're confident we can get people through the testing system over today and tomorrow and the days ahead of next week. But we are going to ask people to be patient, because we can't, the choice we faced before Christmas was, do you hold people over and not let them go on leave after they've absolutely flogged themselves for 9 months? Do you say, no, you can't stand here, we want you to stand around the testing stations on the off chance? We took a view that we needed to have the right balance of resources. We stepped up to 25,000 tests a day pretty quickly. I'm confident we can step it up from there on in over the days ahead.
How much was resourcing? There was a memo that DHHS sent out over the summer period that testing capacity would be down until January 2.
That's right.
How much was it cut by? And then just a follow-up question: New South Wales did 80,000 tests on a single day recently. Why is our capacity, a third of that? Our maximum capacity, a third of that?
Well, look, I think the New South Wales testing numbers, they were running at, I think they had 2 days at 60,000 and just below 70,000, or in that order. That was in the period in the run up to Christmas. It was in a period when they've been running with their outbreak for a while. And yes, they saw a fantastic response from their community to come out and get tested. We haven't seen that same peak load capacity, and our peak load demand has come right between the Christmas and New Year period, when rightly a lot of people, not only Victorians but also the Victorians who are working in our testing system, are taking some well-earned leave. We've brought a large number of people back from their leave plans over the last few days, starting on Friday, and I thank the people who came out and did just that. That is why we're able to deliver 25,000 test results over the last few days. We'll continue to bring people back from leave to do that, and I think that this is about ultimately getting the balance right. If you look at the way this outbreak is running at the moment, we've got all those resources targeted around not only supporting the outbreak, but also supporting the 60,000 people who've come back from New South Wales. So we've got demands on both fronts at the moment, as well, of course, as to supporting our hotel quarantine system, where we've got huge numbers of tests being delivered. We've got 28,000 tests that we've delivered consistently on a day-to-day cycle, supporting all the workers in the hotel quarantine system. So we have a number of different testing priorities, and I'm confident that we've got the infrastructure in place, and the fact that we're punching through these tests and getting the turnaround times with 88% being within 24 hours, I think we've got the balance about right.
I guess my question is, given capacity was so far down over the Christmas period, you're talking yesterday and today about boosting by 30% or 20% or 40%.
Yeah. Are
we only getting back to the original 100% capacity that we had pre-Christmas, or are we above and beyond now because we have an outbreak? No,
we're starting to move above and beyond what we'd normally expect to see on a weekend. And remember, for the last 2 months, for our 60 0 days, we've been running at testing levels of around 10,000, 12,000, 13,000 a day. So we've more than doubled what we've been doing for the last 2 months in a very rapid period of time. And look, and of course, we'd love to be in a position where we can continue to surge up. I'd love to be in a position where we've got shorter waiting times and we can get people through. But we're seeing a very strong and intense response, both from people returning from New South Wales, as well as people who are responding to the calls around the exposure sites and the concerns that we've got. So, look, again, I apologise for the frustration people will feel. I apologise for the length of waiting times, but people are getting through, tests are getting delivered, turnaround times are happening, and we're seeing it in the way that this outbreak is being handled.
You said that more than half of people who are regarded as close contacts have been tested so far.
That's right.
Given the waits for testing, are you prioritising testing for those close
Absolutely,
contacts?
yep. So we're prioritising the testing for people in the key exposure sites, and the primary close contacts are able to either access our normal testing system, or we have dedicated facilities for them as well. We put a pop-up site at the Doveton Church a couple of days ago. That continues to work, so that's why we're seeing such a rapid resolution of this outbreak as we're working so quickly through these primary close contacts.
Can you rule out any of those people having had to wait in line and then be turned away?
No, what I can absolutely confirm is that any primary close contact is prioritised in terms of testing, and any primary close contact, in the extensive conversations we have with them, has many options in terms of how their testing gets delivered.
The DHH website is still very hard to navigate when you're trying to find a local testing site. Currently in New South Wales, if you Google local testing sites, you get a list of sites near you, whereas here you get a map that's almost impossible to read. Do you need to address that so people have a better understanding of what their options are, rather than heading for those drive-through clinics straight away?
Look, I think, Andrew, if we have both a list of sites on our website and a map of sites on our website. I've never found any problem in navigating that in navigating the map and finding out where the sites need to be. So I don't think that's entirely fair. I think the visibility of the sites we're putting on is pretty good. I think the visibility of the pop-up sites we're putting up is pretty good. we've done this a number of times now. We've done this now for a few months. I think people's liking or not of websites is always in the eyes of the beholder rather than the eyes of the operator.
How many days before you think that all of those 60,000 return travellers will be able to get through?
So I mean, a large number of those 60,000 travellers will have gotten through already over the last few days.
Do you have any idea how many so far?
I don't have that data with me. So we're running a regular matching cycle between all of the permit data and all of the test results data to make sure that we can, to some extent, cross people off the list and say, yep, we've seen these people come through and we've seen their test results come through. If I look at the first wave of returnees, over 75-80% of people who returned from New South Wales in the previous weeks got their tests done very swiftly, and of course we followed up the remainder to make sure they did just that. So we'll continue that process with the 60,000. I would expect certainly in the next two days or so that we'll have ensured that the majority of those people have got through, and of course we'll follow up the remainder.
If you have, though, at least 20% by your numbers of the original wave coming back, it's been much harder this time to get tested. These people, with kids as well, have tried again. You'd expect, would you not, a much bigger chunk of those people who just give up and say, I'm not even going to get tested?
Look, and again, I understand the frustration that people will feel. I mean, but equally, the direction we've given to people returning from New South Wales has been, you must isolate, get tested, and either wait for 14 days in the case of the ones returning most recently or returning from the higher risk locations, or wait until you get your test results. So I think people have a pretty good incentive to make sure they get their test, because as soon as they got their test, they can get their result. For a significant number, that will allow them then to release themselves from home isolation. Others have got 14 days of home isolation. So if you're not getting tested, you're in home isolation. So I appreciate there's a frustration around all that. But again, that is something we're asking people to do because of the risk it faces to the wider Victorian community.
Is there not no chance that, there's not a police car outside every 60,000 return travellers? There's a chance that people are not.
Look, the risk is always there. But if you look at it another way, we saw over 60,000 people do the right thing when we stood up 3-4 days ago and said we are increasingly concerned about the risk of COVID exposure, which impacts the people that are in New South Wales and impacts the people that we bring back. So I think 60,000 people made the right decision to cut short their planned journeys and to come back into the state. I'm confident the vast majority will follow through and say, right, I now need to make sure I get myself tested because I don't want to put myself at risk. More importantly, I don't want to put the wider community at risk, including the people closest to me. So, and that is a purpose for our, the messages we're sending to all those individual numbers. We're reminding people of what they've signed up to in terms of their permit. And as we see the testing numbers come in, we'll continue to focus in on the remainder who may or may not have got round to doing that, and we'll be very sure to remind them.
There seems to be some failures in communication still between the department and some of the venues. We've had multiple venues haven't been contacted when they've been added to lists of exposure sites. We're also hearing that for example, the European Beer Cafe, the wrong date was published on the website and then kind of quietly updated at some point. How can we be kind of approaching, a third outbreak and well into a third outbreak in Victoria, and these mistakes are still happening and getting, I guess, quietly corrected when all we've learned from the second wave indicated that these things should be much more open and transparent?
I don't think you can accuse us of being quiet about anything when it comes to COVID. I think we're extremely loud and visible about COVID. We stand up here pretty much every day when there is an outbreak on and talk about exactly what we're doing and deal with these kind of conversations. So I think what we have to recognise with the 51 exposure sites, the lessons we've learned and the hard-won lessons we've learned here in Victoria is that as soon as we're going through our interviews in real time, as exposure sites are put up, we put them up on the website. We want to get them up as quickly as we possibly can because we want to get the information out to people to say, this is what's going on. This is why these conversations are so important. This is why the work that you guys do in publicising that information further is so very important. Absolutely. Even yesterday we had exposure sites being listed. Initial information was it could be a high significant exposure site. We were very worried about it. It got downgraded during the course of the day. So it went from being a high priority exposure site to a medium to a low range exposure site. The alternative is not to put it up at all. So absolutely, we have an option to say we will sit in a bunker and work on all these exposure sites and then release it in a perfect form 7 days later. That's not much point. So we will get the information as we get it, as soon as we possibly can, because we want to be transparent. We want to give people as much notice as possible about the potential risk that's out there. If that means occasionally there's a typo in the name of a cafe, well, I apologise for that. If that in the interest of taking the information down and getting it out there you get those kind of errors. That's always going to happen.
I
When
think
you
we're
do
talking about
realise-
a different thing, sorry, between a typo in the name of a venue and 7 days difference in the date we're talking about. Are you not opening a window for people to kind of see that, oh, this cafe, this venue was an exposure site, I've checked, I wasn't there on the date, all good, you're opening a window for community transmission?
Oh no, I think that's entirely unreasonable, because I think what you'd expect is that as we're putting information out to the public, and that information will continue to evolve and change. We're doing case interviews every single moment of the day. These interviews are happening around the clock. The sites on our website are updated around the clock, so it doesn't just stop. The information we get as it becomes richer, as it becomes broader, will always get updated. So the fact that as the picture starts to emerge, those details will continue to evolve, I think is entirely reasonable. And yeah, the messaging I think the Victorians should take from this outbreak is, we have opened up in the first 3 or 4 days of this outbreak in a really strong way. We have a clear understanding of the close contacts. The positive cases we've now seen, 21, are all in that close contact scatter field. We know where it's come from. We've established the links between them, but there are 51 exposure sites. As Alan has said, none of those exposure sites have yet, apart from the cafe, led to any known positive cases. That doesn't mean they won't. So people need to continue to be alert and aware that this is not over yet. We're tracking in a positive direction. We've got more work to do, and until we run all these lines of inquiry to ground, until we're confident that the cases we're now carrying are all run out, we need to continue to be alert and work on this.
When you do realise that you've published incorrect information about exposure sites, I think another example, Rockpool was listed as having been an exposure site at lunchtime. There were people who'd been there at lunch who panicked. It was then updated to say that it was dinner. Is it possible that you could put out a tweet or a press release correcting that information?
Oh, look, certainly I think if there are significant material changes on if there's a major exposure site that we're really concerned about, where there's new information coming to bear, or if there's a significant change in its time windows, absolutely I think we draw attention to it. We're tweeting and updating the media on a continual 24-hour cycle. We'll continue to do that because it's the right thing to go and do. I think if there are individual shifts on individual exposure sites, it's a matter of proportionality. We're not going to call a press conference every time we find a new exposure site or we decide to move a time window.
Could you note next to the site this was previously listed as being this time that was incorrect, just so people don't get confused?
Look, I think possibly, but equally, as we're seeing now with 21 or so positive cases who have all had a fair amount of activity through the community. With 51 exposure sites being listed, we are seeing also overlapping exposure sites. We're seeing cases who are entirely unknown to each other visiting the same venue at different times. That picture is always going to be confusing. So I make no apology for putting out exposure sites where we may then further, as information evolves, as we see more information come to bear, that we may either grade them or we may change the time windows around them, because I want Victorians to be aware that there are locations that we're all going to in our normal day-to-day life where at this point in time, because we have an outbreak, we're seeing positive cases move around. And that's why that zero status is so desirable, because we've not had to worry about this for the thick end of 2 months. Now we're in a position where we're seeing positive cases trundle through our society again, and all of us are having to be a little bit more alert again and saying, right, well, actually, did I go to Rockpool? I didn't. But if I did I go to Rockpool? And if so, should I be alert?
And just to clarify, you mentioned a winery in Strathbogie yesterday as an exposure site.
Yep.
Was that actually an exposure site, or was it mixed up with a winery with a similar name in Lakes Entrance 5 hours away? And if so, how do you confuse two places that are on completely different parts of the
not
state?
familiar with the details of that. Happy to take that on notice.
Alan, can I just ask, just for Alan, would there have been a need to close the New South Wales border if the authorities up there had introduced mandatory mask rules, say, 2 weeks ago?
Look, I think it's always hard to know. I think the assessment that we made was on the information we had available, and my job is to give advice to the Victorian government, and I can't really comment on the settings in New South Wales.
Did you have any conversations, or you or your team have conversations with them about what had worked down here and what you suggested might be beneficial to them?
So we work very closely with all the Chief Health Officers. I've just had a missed call from another Chief Health Officer just while I've been standing here. We speak every day. AHPPC has been meeting pretty much every day over Christmas and New Year. You know, they're fully aware of what the settings have been in Victoria and what the outcomes have been. But again, my job is to give advice to the Victorian government on public health measures here.
Is it frustrating though that they haven't learned from our lessons in many ways and they're not adopting that aggressive contact tracing approach of isolating secondary contacts like we have, which has worked so well for Kilmore and Shepparton?
Look, I mean, I think, you know, they're a very experienced team in New South Wales. I don't really have any criticism of all the things they're doing. Clearly, they're in a slightly more challenging position than we are at this point in time. I think they're doing a great job.
Can we just ask you, the government?
Can I just ask Alan one more? You mentioned the link you're looking for, the Sydney person who hadn't been to the Northern Beaches but had been here. Can you talk us through a bit more of that? Is it someone who was at the Buffalo Thai restaurant?
So yeah, someone at the Buffalo Thai restaurant had been in New South Wales. We're liaising with our New South Wales colleagues about the exact movements. They don't quite line up completely about, certainly it hadn't been at any of the RSL or the Bolo or anything like that, but it's certainly a lead we're chasing down.
And is that the same situation?
And just noting that we had previously we had known that two people that had returned from New South Wales were also at the cafe, separate to this person, and they've tested negative. So we no longer think that we had thought that might have been a link, but we no longer think that.
How worried are you that you don't have this patient zero now?
Look, I think you know that is of some concern. When we think about risks, we think of upstream risks, who spread the infection, and then the downstream risks. I think we're increasingly confident we have a handle on the downstream risks. So with the primary close contacts being put in quarantine and being monitored carefully, and we're continuing to try and chase down the upstream risks. I think, you know, this is now going back to the 21st, which is now a little while ago. So if there had been any further cases from that upstream contact, then we might expect to have seen some by now, but it's something we're certainly concerned about.
Is that the New South Wales person you're looking at directly linked to the, I guess, Mentone patient 0 or patient 1?
So the Thai cafe is where 13 of the cases were, including the Mentone case. We no longer think that the Mentone case is the first one in that, and which one is the first one is now, and how they got infection is.
So the first one could be any of those 13, and you're still looking for how they got it.
Yeah. So the direction is not always easy to infer.
Just to clarify, originally it was thought it was a couple, now it's thought it's someone, an individual, but someone else not in that couple.
Yeah, that's correct.
How many contact traces do we have at the moment, and do you think that this chaos could have been avoided if we had waited, say, 24 hours before telling everyone to come home and get tested?
Sorry, I couldn't quite hear that.
Sorry. How many contact traces do we have working at the moment, and do you think this chaos that we've caused by telling everyone to come home and get tested could have been avoided if we waited, say, another 24 hours?
I don't know how many contact traces we have at the moment, but certainly all the teams are working very hard, and we've certainly got onto all the primary close contacts. So we have enough contact traces at the moment. In terms of, I mean, I think it's difficult to know. I think until we know who was the first person that brought back the infection, then it'll be hard to know what might have been done to have avoided this.
Alan, are you confident that this is under control now, this outbreak? How are you feeling about it?
Look, I think I'm encouraged that all the all the cases that are popping up yesterday and in fact throughout all of this are linked. So going back to the first days when we had one case in Mitcham, one case in Mentone, and one case in Hallam, that's obviously a very concerning situation if we couldn't link them together. Now we have drawn links between them all through the cafe, and all the new cases are being detected in people who are close contacts. So we have we identifying those networks, as it were. Obviously, you know, it's still relatively early days, and you know, if further cases pop up, then there still could be cause for concern, and that's really why we're wearing masks and why there are limits to private household gatherings. But it is encouraging at this moment anyway.
And if it continues as we are on a downward slide, how long would we have to keep wearing masks, and how long would we restrict those household gatherings?
Oh, look, we'll look at that each day. I think we don't want to you know, have to do this a moment longer than we need to. And I think, as we had earlier in the year, you know, one swallow doesn't make a summer. We do need to keep an eye on numbers as they unfold. But
another couple of weeks though, or just like a rough guide?
Oh, look, I would think so at least, but we'll look at it each day.
Just sorry, just wanted to clarify. You and Jerome both said that none of the cases have got them from other exposure sites. But speaking to Yarra Trams yesterday, who has an employee with a positive case, they told me that their employee got it from an exposure site. Was that an exposure site at a family gathering? I'm just trying to clarify how they got it.
So I'm not sure about, and I'm not sure I can speak to that case specifically, but all the cases were either 13 of them were at the Thai cafe on the 21st, and all the other cases are linked to those cases, either directly, as in they were at, you know, spoke to someone that was at the cafe, or indirectly they spoke to someone they met with someone who was a case, and generally in family gatherings. So we've not had any transmissions at any of the other 51 sites other than the Thai cafe at this stage. But obviously that's something we're keeping a close eye on.
Can we ask the Acting Premier just a quick question?
Yep.
I know we spent a lot of time on testing, Minister, but I wanted to ask you as the Acting Premier what your view on the current situation was. The government made a snap decision to close a border, which inconvenienced a lot of people. Obviously it was in the public interest, but there's a lot of people who had to end holidays and stop seeing family and come into Victoria, and the strict condition was that they needed to get tested and isolate. It's now abundantly clear that there was not capacity to test anywhere near that number of people. Was that a satisfying situation for you? Was that ideal? Do you accept that there was an error made by the government, either in telling them they needed to get tested or making them come back that quickly and not standing up to capacity?
Well, first and foremost, the decision was based on the public health advice that we received on New Year's Eve. And if you think back, it was just 4 days ago, we had a rapidly changing situation in New South Wales. We had what was then the first 3 cases here in Victoria, and within 24 hours, our tracing team had identified the links, had identified the cafe in Black Rock as a potential source of where those cases were linked, which, as Alan has said, is now borne out to be the case. And so the public health advice was on New Year's Eve was to move quickly, remembering, of course, that in the previous 10 or so days before that, there had been very clear advice coming from Victoria to Victorians about the risk of travelling to New South Wales. It was back on the 18th of December that first advice was given, when the outbreak was started to emerge out of the northern beaches in New South Wales. And since then, and then on the 20th of December, the Greater Sydney area was also then declared a red zone, and progressively other areas of New South Wales were added as we saw more cases emerge in New South Wales. And then the decision was taken that because of the spread of the cases across New South Wales, that it was in the best interests of protecting Victoria and Victorians to close the border to the entire state, and that we needed to move quickly because of the unknown spread of the virus in New South Wales, plus the emerging cases here in Victoria. And so that was the very clear advice, the public health advice that we received on New Year's Eve. And when you receive that advice, it's incumbent upon the government to move as quickly as possible and to give that advice to the Victorian community. And yes, I do acknowledge it provided for a very difficult 24, 36 hours for people looking to return from various parts of New South Wales, and reiterate some comments Jerome has made about thanking Victorians for the way they responded so quickly. 60,000 people crossing the border in that 2-day period demonstrates that Victorians understood the seriousness of the situation and the need to get home and get tested. And I think what we're also seeing now that Victorians are home and following the advice to get tested is it further underscores that Victorians understand how important it is that each individual has a role to play in keeping our community safe. We saw that over the course of 2020. We're seeing that into 2021. And the comfort we can take is that the settings we have in place, the bringing back of the wearing of masks indoors, the restriction on the number of people you can have in your home, plus the terrific work that's going on by the tracing team who are working so hard at identifying the cases and the links and the locking down of the primary and the secondary contacts, plus the testing regime is all locking in together to have us in the situation today where we're only announcing 3 new cases. They're all linked, and that gives us great confidence about the situation here in Victoria right now. Yes, it has been a challenge over a holiday period, a holiday weekend, after a year where we wanted to make sure that our hard-working health workers had the chance to have a bit of a break. We've called so many of them back, and we thank them for coming back from their leave to assist over this weekend. And yesterday, today, tomorrow, there's additional capacity being added to our testing sites across the state. And Victorians, are really to be given such great credit because it's clear they understand how serious this is, how important it is to get tested and then go home and isolate till those results come in.
Have you made any further requests for ADF support on the border, given the pressure that the border is placing on Victorian Police?
Yeah, not at this stage, Andrew. And remembering, of course, that the border resourcing has been in place since the 18th, 20th of December, when that decision was taken a couple of weeks ago to declare parts of Sydney as red zones. The border enforcement was put in place at that period of time. So in declaring all of New South Wales, shutting the border to all of New South Wales actually didn't require additional resourcing from the border points point of view. Obviously, there was additional pressure and additional resources had to be put in place for that New Year's Eve period as more and more people came through. But we already had existing resources along the border. VicPol, other parts of the Victorian government had resources already stood up along the border.
But there's about 700, and then we know there's hundreds more in hotel quarantine as well. This is a huge demand on Victorian Police Service. You cannot possibly argue that it's not affecting other areas of their operations. The longer it goes on, the harder it's going to get, isn't it?
Well, look, I'd let Victoria Police speak to their operational response, and you're right to give an acknowledgement to the tremendous response from Victoria Police. I've mentioned a couple of times this morning how our health workers have come back from leave and have worked really hard over this normally a holiday period. So have Victoria Police. You know, they've also had people perhaps not take leave or come back from leave to assist with the resourcing of both the border, COVID accommodation, and then the other assistance required around our testing and tracing program. And the important element of all of these resources being thrown at this issue is about keeping our community safe and about slowing and stopping the spread of this virus. And the fact that we've got only 3 new cases today, all known to the public health team, all linked to the same cluster, should give us great comfort that yes, a lot of resources are being thrown at this, but that is absolutely the right thing to do to help keep our community safe.
Given that we know that, you know, there's 60-odd thousand people coming across the border who need to get tested, and many thousands of which haven't been tested yet, we're getting through about 20-odd thousand tests a day, maybe at the moment. Normally, at any given time, there's still several thousand people getting tested. I mean, the maths just don't work, you know, over a short period. There are clearly people either pulling out of lines and going home and not getting tested, or sitting at home just waiting. What kind of fears do you have that there are cases undetected in the community that just aren't getting tested at the moment?
Well, I would reiterate Jerome's point from earlier to encourage people to continue to make sure they can get their test, and if they're not able to get a test yesterday, that they practice the isolating, be home and isolating, and not moving around our community. But I also some of the figures Jerome gave earlier. We had 22,500 tests processed yesterday. As you said, there's another 8,000 or so sitting in the lab that came in late yesterday that are still being assessed. So that's in effect 30,000 tests that were collected yesterday. So we are seeing a huge volume, back to sort of pre-holiday level volumes of testing being undertaken yesterday. We've got greater capacity added today. There'll be more capacity added tomorrow and into the course of the week that I think can give Victorians confident that they know, Victorians clearly understand the importance and the need to go and get tested. There are sites available, 190 sites across the state. There is information available, and we do encourage Victorians to continue to work through the testing program, to get tested, to isolate and until the results come in, or isolate for the 14-day period depending on your travel circumstances, because it's going to be very, very important as part of that overall effort to keep our numbers low, to slow and stop the spread of this virus, and so we can resume, hopefully in the not too distant future, to some of the lessening of the restrictions, like the masks and the private gatherings that we saw was able to be achieved towards the end of 2020.
So how much extra capacity do you anticipate being available tomorrow?
I might ask Jerome to talk to that in terms of, because there is significant effort that's added capacity today, and significant effort that's being made to add capacity to tomorrow. And just before I do ask Jerome to add to that in terms of some of the more precise details around the capacity. The reason why we've been able to add capacity is because we've got a whole bunch of health workers who have come back from leave, who've worked so hard in 2020 and have come back and to have assisted with this surge effort over this weekend and into next week. But I'll just get Jerome to
one more
round
question
out.
for you, if I may.
Sure.
There seem to be hundreds of people who, when Sydney was initially named a red zone, moved to green zones of New South Wales. They planned to stay there for at least 14 days and then come back to Melbourne. When the border closed, they tried to come back to Melbourne, and they've now found themselves either detained in hotel quarantine or stranded on the other side of the border. Do you have some empathy for those people?
Well, I think as we saw in New South Wales, and I mentioned that period of mid to late December earlier, there were almost every day or second day more cases emerging, and in different locations around the state. And if someone was originally in Sydney on the day that we declared Sydney and that Greater Sydney area a red zone, then they needed to follow the rules that were associated with that red zone. And we've had a permit system in place since the 18th of December for all people travelling in and out of New South Wales, not just Sydney, not just the Northern Beaches, but all of New South Wales. And this was clearly communicated at the time, and since then by Minister Foley, by the public health team and others. And so that has been the circumstance that was in place at that time. And yes, we do acknowledge that on New Year's Eve, the border for the rest of New South Wales was shut. We had to move quickly because it was based on the health advice about what needed to be done to protect Victoria and keep Victoria COVID safe.
Is there any, can I just get one more, sorry, just on the same topic, Minister. Yep. Is there any consideration being given to how to get Victorians back from New South Wales who are stuck there if the border closure goes on for weeks or months?
Look, again, that is something that Jerome can speak to, and he mentioned before that there's around 1,500 people have applied for an exemption to the border measures, and we would encourage people, if they have particular circumstances or are wanting to seek an exemption, to contact the department and talk through that process. But we did see 60,000 people come back in 2 days, so the huge, overwhelming number of people who have come back and have been able to get back ahead of the border being closed, and there remains that exemption process for people who remain in New South Wales. But again, both that and the other issue about testing capacity for tomorrow, I might throw to Jerome to answer. Thanks, Jerome.
What about the non-exempt people, Jerome? The new Victorian
Let me just deal with Andrew's question because he's paying attention, and then I'll come back to directions. So in terms of testing capacity tomorrow, so we'll have over 200 sites open tomorrow. We have 190 sites open today, over 200 from tomorrow for the foreseeable future. I'd expect also we'll have obviously more staff coming back into the existing testing sites tomorrow as well. So overall we should have around a 10-15% uplift from what we have today. Again, today a significant uplift from yesterday. And again, let me to reiterate, my thanks to all the Victorians who waited in line yesterday and got tested, and for those who are going to be in line today to get tested, we will get you through. In terms of exemptions, so yes, we've got
people in Victorians in New South Wales who don't have special circumstances. Are they just stuck until the border closes?
Look, and let me just reposition the whole thing. So we've got 1,500 people who've applied for an exemption. Anybody, any Victorian, anybody in fact who finds himself in New South Wales who believes they have an important reason to get back to Victoria, is invited to apply for an exemption. That does not mean you will be granted an exemption. We will only be granting exemptions to those who've got a genuine medical, emergency, family, hardship reason to get back in. And there will be conditions applied to those individuals in terms of how they then need to test and isolate during their stay here, or whether they need to go into mandatory hotel quarantine. That is what the exemption process is for. And absolutely, look, I sympathise with people who have found themselves possibly locked down at the northern beaches as part of the New South Wales lockdown, possibly who would have left Sydney and have been in rural New South Wales. But we have to take a view about what's right for the wider Victorian community, and as the acting Premier has said, 60,000 people managed to get back under severe hardship with a lot of inconvenience in that time. We will always be very, very keen to hear from people who feel they have an important reason to be back here. But that is what the process is for, and it'll be done on public health grounds.
That exemption process, the exemption categories won't be widened at all as the weeks go on if this border remains shut to say young families who just need to come home because they don't have money.
So look, it comes down to ultimately a balance of what is proportionate and what are the changes people are in. Each situation will be unique. Given the volumes we've all seen come back into the state over that New Year's Eve, New Year's Day period, we're confident that the vast majority of people who either didn't travel to New South Wales for the 10-12 days that we're talking about are concerns about the risks of travelling to New South Wales, as well as a large number of people who've come back over that last week period. We would have thought that the vast majority of people who want to be in Victoria are now back in Victoria. There will clearly be a number that are still in New South Wales. The exemption process is there for people to apply. If people don't get through in the first time, they can of course apply again if their situation changes. We will keep a close eye on that, but ultimately we will do what's best for the wider Victorian community in terms of the public health risks that represents.
How many people are in hotel quarantine now anymore over the past 24 hours?
I don't have any update in the last 24 hours. We have around 170 in hotel quarantine at the moment who have come out of the New South Wales border closure over the last 10 days or so.
170?
170.
And what are the reasons generally? Ignorance, trying to fudge the system?
Oh, look, I think it's largely people arriving at Melbourne Airport without the appropriate permit documentation.
And are hotel quarantine venues allowed to host functions that are open to the public, or are they exclusively?
No, they're exclusive. All the hotel quarantine hotels are exclusive to hotel quarantine use.
So if they get, it's everybody who hasn't properly applied for permits, or?
No. Look, we did see some people arrive in the last 2 days after the border had closed at Melbourne Airport, and they went into mandatory hotel quarantine because there is no recourse for them to do anything else at that point in time. So again, we say to people the reason the exemption process is there, and I'm very grateful to the 1,500 people who have applied for an exemption, because then we can work with you individually to assess your situation, and if there's a genuine grounds to bring you back into the state in a safe way, we will support you to go and do that. But there have to be genuine hardship grounds. Given that we've significantly inconvenienced 60,000 people who did the hard thing and got home on time, and given that we have genuine concerns about the level of virus circulating currently in New South Wales, and we ultimately need to make sure that we get the Black Rock cluster well under control, and that we ensure that we don't see any further incursion of the virus back into Victoria. Okay.
Minister, is there any chance that we would ask these people to pay for this? Given 170 people is very costly to have in hotel quarantine. Is there any move to make them pay for it like the international travel?
No, there's no move at this stage to have those arrangements in place for New South Wales return travellers as there is for international travellers.
So can I just clarify, are they required to pay or not?
No.
No.
The return travellers from New South Wales.
Because some of them were received two different types of advice. I'm told that authorised officers initially told them they wouldn't have to pay because the legislation's not in place, and then other people on the bus to hotel quarantine told them they would have to pay.
Well, I think if anyone's got is seeking any further information or clarity, going and getting information directly from the Department of Health and Human Services would be the best place to go.
So I think both these messages came from DHHS people.
Well, you're citing an anecdote there that's a little difficult to respond beyond the response I've just given, and also to reaffirm that for New South Wales return travellers, it's not our intent to have them to be charged for the period they spend in hotel quarantine. Okay, great, thank you.
Yeah, having been told by operator officers they didn't know, clearly they don't. So yeah, it's just
Just roll on dream team back together.
yes, yes. Even though, you know, even people who own venues have